When the government first announced a phased incremental approach to universal health care, not many thought it would get further than pregnant mothers and newborn infants in a few years, especially given the state of the national medical complex at the time. In less than 4 years, however, the initiative has moved far beyond free lab tests for pregnant mothers. In the latest edition of Meet the Minister, Honorable Moses Baptiste, Minister for Health, Wellness and Elderly Affairs, provided an overview of this vital initiative.
Universal health coverage is a system where the people of a country, let's say Saint Lucia, gets access to a package of health services without causing them further financial burden. And that package of health services is quality health services. It is health services that is available. It is health services that does not discriminate. And it's health services that is accessible. And the key thing about it is that you need to access it and it reduces your out-of-pocket expenditure.
Recognizing that the successful implementation of UHC requires attention not only to cost but also to the supporting systems, the Minister for Health emphasized the deliberate and focused efforts made in developing the policy.
Let us create a unit within the ministry to focus only on universal health coverage. We are not going to have it just as a line item in the ministry and talk about it all the time. So I went to cabinet and the Prime Minister loved the idea. The cabinet of ministers supported it. We say, yes, let's do it. So we implemented a unit within the Ministry of Health, Wellness and Elderly Affairs to focus solely on the implementation of universal health coverage.
The Health Minister further stated that with the policy's phased implementation, the initial focus was placed on maternal and childcare services, benefiting approximately 2,500 expectant mothers between 2023 and 2025.
The first one we launched was maternal and childcare services. So that's tangible.
Yes.
So we have a number of St. Lucians. We said, okay, any lady who's pregnant, who goes to the wellness centers, they will get there were some regular services before. So when a lady went to the wellness centers, they would get some services. But we reorganized those services. So you would get your checks and so on. If you needed additional consultation, you would get all of these without any cost to you.
The phased rollout also included cervical cancer screening, which has supported approximately 3,000 women, prostate screening for around 450 men so far, and the launch of a snakebite management initiative. These efforts reflect the government's continued commitment to placing the health and well-being of its people at the center of national development, targeting a broad cross-section of the population. For Choice News Now, I am Dyrud Lionel.